Howdy, Athenians. It's your city manager, Seth Sumner, here with your daily COVID-19 update. It is Tuesday, the 5th of May, 2020, and of course we're going to start by looking at the Tennessee Department of Health data just to give you a brief update of what our numbers are showing us today about this novel coronavirus. So we are seeing now 13,690 total cases, an increase of only 119. Now, an increase whatsoever is not what we're looking at right now, but as far as the last several days and the increases that we've seen, largely because of testing the prison population, 119 is a much lower level than we've seen in the last several days. So that's something we look for, a lot of things to be thankful for right now, and that could be one of them. Just like this next number, 6,356 Tennesseans fully recovered from COVID-19. That is an increase of a good number, 275 since yesterday. One of the issues that we talk about a lot is what is going to be the level of usage of our hospitals, of our ICU, ventilators. What is going to be the need of those assets that we have only 7,812 hospital beds across the entire state. How is that resource being affected? Right now we can see that there is a slight increase from yesterday of 13 people having to seek acute treatment in a hospital right now. So 1,156 hospitalized Tennesseans. Another good number, we continue to see this increase as Tennesseans are being responsible because we care for each other, because we love our friends and our neighbors, and we love the elderly. We have grandparents maybe we're fortunate enough to still have in our lives right now. We want to make sure that they don't come in contact with COVID-19 because the elderly population and those with weakened immune systems are adversely affected more than healthier and younger populations are with COVID. We are still seeing about 1 in 3 elderly persons that contract COVID are perishing, and about 1 in 4 seniors that contract it are perishing. And so that's too much. That's too many people. We have to take care of those people and make sure that we're doing our part to stay apart, that we're seeing to their needs from a distance, so that we don't unknowingly, because we do know now that a lot of these positive tests that are coming back, the persons are asymptomatic. So we have to know if they may be unwittingly transferring this virus to another person. So 218,796 tested. That is an increase of over 7,300 since yesterday. Now a sad note that we have to acknowledge is the deaths that are happening because of COVID-19, and especially people with weakened immune systems and our aging population. 226 total Tennesseans have lost their lives to COVID-19. That is an increase of 7 since yesterday. We're sad that anybody contracts this virus. There is no cure. There is no treatment for this virus. It is too new. Our scientists, our doctors, our professionals are still working on those things. They have some things that they're experimenting with right now, but as far as having a cure, having the antibodies, things of that nature, we don't have that yet, and we're still likely several months at least away from having a treatment such as that will be helpful, where we can inoculate people or create a herd, help me out, James, a herd immunity. I'm sorry. Very little sleep last night, staying up worrying about our citizens here. And the dangers that we still see out among our population as we're trying to reopen our state because we want our businesses open. We want our businesses successful because that's food on their family's table. The business owners, the staff of those businesses. And so Governor Lee is rolling out more guidelines I'll talk about in a second. But we want to get those people back responsibly. But know that we still are and will be under a threat of this novel coronavirus. And if you have any doubts of that, you need not look further than the 226 Tennesseans now and their families. They've lost loved ones, and we don't want to see that at all. So we all have to be responsible. We all have to do our part in this and take care of each other. Without our health, we have nothing. Let's look at McMinn County numbers. McMinn County, here we are. Now, we have seen some information coming from Life Care and news outlets that they are saying that the death count is higher. I'm not sure what the discrepancy is between the Tennessee Department of Health and their reporting. That's not something that we get into on this. This is just an update of the state of Tennessee's Department of Health data. Is all we've been providing on this. But we are now showing 2 deaths by their data collection methods. We are seeing now 12 fully recovered McMinn Countyans. Great job. We want to see everybody else, all of these 106 now, total positive cases, fully recover if possible. And that means that our families, that the healthcare professionals are going to do their job. They're going to do their part. We're going to take care of each other because that's what we do as Athenians. We love our neighbors. 106 total. And that is out of 1,654 now negative tests. 1,654 McMinn Countyans have now tested negative for COVID-19. That is great. What we still like to see from this data is that we do acknowledge there is a cluster at a long-term care facility, and the majority of this number is from that cluster. And we went a long time without any extra positive cases. We went 16 days from 3. 16 days we stayed at 3. And so what we're hoping to see, and it may be days and weeks ahead before we're able to look back and actually truthfully say this is the case, but we're not seeing it generally among our population, which would be a great thing. But we still have to be cautious because we don't know. There are a lot more McMinn Countyans than 1,654, right? 55,000 of us in 1,654 have tested negative, 106 tested positive. So we still have to be cautious. That's our numbers for today, and the governor just held a press conference. I will update you on just the highlights from that very brief press conference a few minutes ago. The governor was sharing his concern over all Tennesseans right now. Tennesseans are hurting. Business owners, employees of non-essential businesses, and folks in general, our emotional as well as our physical well-being is at risk right now because we're not able to do what we've grown up, what we've lived our whole lives being able to do. Hug our friends. Something as simple as a compassionate hug to show that we care about each other, we're unable to do right now outside of our immediate family that lives with us. And so that's difficult for a lot of people. I'm a hugger, and that's difficult for me. It's difficult emotionally because we are apart. It's difficult because we're in isolation. A lot of times, if we're being responsible, we're in isolation away from other people. And that is, we're social creatures, aren't we? Humans are social creatures. We need to be around and with other people. And we're not able to do that if we're being responsible right now. If we care about other human beings, our own family, our own friends, then we're being responsible and we're staying apart, right? We're doing that because of CDC guidance, the White House guidance, our governor's executive orders and guidance, and we're doing that because we're human and we care. So he recognizes, our Governor Bill Lee recognizes that people are hurting financially, physically, emotionally right now, and so there has been an increase in resources and making sure that especially on the psychological, on the emotional side, that we're paying some better attention to that and paying attention to each other. We can join each other through a phone call. We can join each other through some screen time where we can actually see each other's face, and that helps. It's not as good as a hug, no, but it's better than getting sick or passing on this virus to someone who may perish. And that is a responsibility that we all have here in our free society, in the Republic, is to be responsible. It's our duty. We have a higher burden because we have freedoms, and that is to be responsible. So he also called on us, if you are in the position that you can donate food goods, money, if you can volunteer time, if you're a healthy individual and you can volunteer time or those goods, call a local food bank, call your churches, see what you can do to help our neighbors in need right now. Maybe you can be that difference that gets somebody through, or that voice, that phone call that they need to make their day and lift their spirits. And we all need that right now. He also wanted to make a statement about the Tennessee Pledge. It is a pledge that we hope that Tennesseans will follow and abide in, that we are being responsible and taking care of each other. And that is, he highlighted that we're going to continue social distancing, continue practicing social distancing. Even though we might be able to go back to small group gatherings soon, you still need to adhere to social distancing. We cannot let up. We must be vigilant in these practices to make sure that we get rid of the active COVID-19 virus in our community that can be and may be being transferred right now between individuals. We have to be vigilant with that, because I don't want to be the cause of someone else dying because I unknowingly transferred this virus to them. That's a burden that we all share, and I hope you're taking this seriously, folks. In this together, we are in this together, and we are here to help one another. If you feel the need to get tested, then you can get that COVID-19 test, that nasal swab, for free at any health department across the state of Tennessee. Right here locally in Athens, you go to the Macon County Health Department, and they're able to do that for you there. Continue to get tested so we know for sure whether you have the virus or you do not. And it is free, no cost. And those results are coming back now within 2 days. We're seeing a lot of those. The governor also talked about moving to the next phase of reopening Tennessee's businesses. And so he wants you and us, and we'll be sharing it with you when it is released, to be on the lookout for new guidance for small group recreation. That is small groups, so you think about the family going to play putt-putt together. You think about the family going to play, going to the bowling alley. Businesses of that nature are going to be able to reopen under the governor's guidance as early as Friday, May 8th. This coming Friday, those small group recreation opportunities may be able to start happening again if that's what the business owners wish to do. And so there will be new guidelines rolling out, and we'll be delivering those to you here in response to what our governor and the Economic Recovery Group is putting out there. Also, let you know there's been some more quick movement here in the city with the Athens Economic Recovery Team. They have been meeting online and discussing some new ways that we can be helpful to our businesses and to our consumers, to our customers, to our citizens that may want to shop responsibly in these businesses that are now reopening. We want you to still consider that social distancing, wearing your face mask, cover your eyes if you can, face protection, eyeglasses, safety goggles, things of that nature. If you have to be in those essential businesses where people have to go, people have to eat, they got to get groceries. They have to get those things. Those are essential items, but we still have a duty to be responsible here. So that Athens Economic Recovery Team has been meeting and is working on a web page now to be a landing spot to help advise, offer guidelines, offer support, and talk about those phases as our businesses are reopening. So we're looking forward to hopefully rolling that out in the next few days. And so stay tuned, and we'll share that response to you. We'll leave you with again, we have to do our part by staying apart. We've got to take this responsibly. We have to take this seriously and be responsible. We have to love one another. That's what this is about. Love each other. We're together, apart. Please take care of our folks in need. Call on that elderly neighbor. Send a text, call. They're modern. Send a message. Let them know that you're thinking about somebody. Call your grandmother or grandfather today. Call your mom. If they're still with you, call those family members. Call that cousin you haven't seen in 3 years. Tell them that you love them and you're thinking about them. We don't have to be physically next to each other to let somebody know that we care about them. Let's love our neighbor, folks. Let's be responsible, and let's understand that this is affecting people's lives. Financially, physically, emotionally. Please be that guiding light in somebody else's life. Be a positive person that uplifts and cares for our neighbors, because that is what the Friendly City is about. May God bless you. May God bless Athens.